Ladies and gentlemen, thank you for being here. Today we're addressing a topic often shrouded in silence, especially for those in their later years: masturbation. Let's approach this with empathy, respect, and a commitment to truth. While the title might sound provocative, my goal is to dismantle myths and offer reassurance. So if you're between 62 and 83 and still masturbate, here are 6 things I'm sorry to tell you. Though you might be glad to hear them, let's begin by addressing the elephant in the room: the assumption that aging and sexual autonomy are incompatible. Society often paints later life as a phase of quiet resignation, where desire fades into the background like an old photograph. But here's the truth: your body is not a machine with an expiration date stamped on it. It's a living, evolving entity capable of pleasure, connection, and vitality at any age. Masturbation, far from being a relic of youth, is a testament to your ongoing relationship with yourself, a relationship that deserves celebration, not secrecy. First, let's talk about physical health. When we engage in self-pleasure, our bodies respond in ways that science has long validated. For starters, the act releases endorphins, those natural painkillers that flood the brain with feelings of well-being. For someone navigating arthritis, chronic pain, or the stiffness that often accompanies aging, this biochemical boost can be a gentle yet powerful form of relief. Imagine easing a sore joint not just with a pill but with a natural, accessible practice that also happens to feel good. Then there's the cardiovascular aspect. Sexual arousal increases heart rate and improves blood flow, which, much like a brisk walk, supports circulatory health. For older adults, maintaining healthy circulation is critical. It's linked to everything from cognitive sharpness to skin vitality. Why wouldn't we embrace a practice that keeps the body's systems humming? Sleep, too, is a cornerstone of well-being that often becomes elusive as we age. The relaxation that follows orgasm, thanks to the release of oxytocin and prolactin, can be a natural sedative. Think of it as a reset button for the nervous system. In a world where prescriptions for sleep aids are on the rise, here's a drug-free alternative that's been hiding in plain sight. And let's not overlook pelvic floor health. For women, regular arousal and orgasm can help maintain muscle tone, reducing risks of incontinence. For men, ejaculation has been linked to prostate health, with some studies suggesting a correlation between frequency and lower cancer risk. These aren't fringe benefits, they're compelling reasons to view self-pleasure as part of a holistic health regimen. But the benefits aren't just physical. Mental health in later life is often fraught with challenges: grief, loneliness, or the existential weight of life's transitions. Masturbation offers a private sanctuary, a way to reconnect with joy and agency when the world feels unstable. It's a reminder that pleasure is not frivolous. It's a form of self-ref. For those who've lost a partner, it can be a bridge between intimacy past and present, a way to honor one's body without guilt or shame. And for those grappling with the societal narrative that aging equals invisibility, it's a rebellious act of self-affirmation. I am here, I am alive, I belong to myself. Of course, we can't ignore the cultural baggage. Many grew up in eras where masturbation was whispered about as a sin, a pathology, or a joke. Religious teachings, outdated medical advice, and pop culture tropes have left generations wrestling with internalized shame. But here's the irony. While society clings to stereotypes of sexless seniors, research tells a different story. A landmark study published in the Journal of Sexual Medicine found that over 60% of men and 40% of women aged 60 to 93 remain sexually active, with masturbation being a significant component. Yet, how often do we see this reality reflected in media, healthcare, or everyday conversation? The silence is deafening and damaging. It tells people their normal, healthy behaviors are aberrant, reinforcing isolation. Let's also confront the gendered double standards. Women in particular face layers of stigma. Aging men are often portrayed as still having it, while older women are erased from narratives of desire altogether. This isn't just sexist, it's dehumanizing. Pleasure knows no gender, and autonomy over one's body is a universal right. Whether you're 25 or 75, your capacity for joy is not dictated by societal scripts. Perhaps most importantly, masturbation is an act of self-acknowledgement. As our bodies change, slower arousal, different sensitivities, the need for lubrication or adjusted techniques, it becomes a dialogue, not a performance. It's about listening to what feels good now, not chasing the shadow of younger days. This adaptability is a metaphor for aging itself, a process of continual discovery, not decline. So if you've ever wondered, is this okay? Am I too old for this? Let this be your permission slip. Your choices are valid. Your pleasure matters. And if anyone, whether a dismissive doctor, a judgmental relative, or the voice of internalized stigma, tells you otherwise, remember, they're not the authority on your life. You are. Let's dismantle another pervasive myth, the idea that aging and desire are mutually exclusive. Society loves to package sexuality as the exclusive domain of youth, sleek bodies, unchallenged stamina, and a cultural obsession with peak performance. But this narrow framing isn't just inaccurate, it's harmful. It erases the lived experiences of millions who continue to explore pleasure, intimacy, and self-discovery well into their later years. The truth is, desire doesn't retire. It evolves, deepens, and often becomes more intentional. A fact rarely acknowledged in a world obsessed with selling anti-aging creams rather than celebrating the richness of lived experience. Consider where these myths originate. For decades, pop culture, advertising, and even medical institutions have perpetuated the stereotype of the sexless senior. Films and TV shows rarely depict older adults as sexually active unless for comic relief. Think cliched scenes of dentures clattering into a glass beside the bed. These portrayals aren't just reductive, they're dehumanizing. They reduce complex, multifaceted individuals to punchlines, reinforcing the lie that aging equates to irrelevance. Meanwhile, the multi-billion-dollar porn industry, which shapes so many societal perceptions of sexuality, overwhelmingly caters to young audiences, leaving older viewers to navigate a landscape that pretends they don't exist. But here's the reality. A 75-year-old's desire is no less valid than a 25-year-old's. It's simply different. Informed by decades of experience, self-awareness, and a deeper understanding of what brings fulfillment. The consequences of these myths are profound. When older adults internalize the message that their sexuality is inappropriate or unseemly, it breeds isolation and shame. Many avoid discussing their needs with partners or doctors, fearing judgment or dismissal. Healthcare providers too often overlook sexual health in older patients, assuming it's a non-issue. A study in the Journal of the American Geriatric Society found that fewer than 20% of physicians routinely ask patients over 50 about sexual activity, perpetuating a cycle of silence. Yet we know that sexual expression remains a vital part of life. For many, research from the National Poll on Healthy Aging reveals that nearly 40% of adults aged 65 sexually active, with a significant percentage engaging in masturbation as part of their solo or partnered lives. These numbers aren't outliers, they're proof that society's narrative is out of step with reality. Gendered stereotypes further complicate this picture. Aging men are often grudgingly granted a semblance of sexual agency. Think of the silver fox, while women face harsher scrutiny. A man in his 70s who dates younger partners might be labeled a player, but a woman doing the same is often met with scorn or disbelief. This double standard reflects a broader cultural discomfort with older women owning their desires. Actress Helen Mirren, at 76, once quipped, "People say, how dare you still be sexy at your age? But why not? You don't lose your sexuality just because you get older." Her defiance underscores a critical point. Sexuality isn't a switch that flips off at a certain age. It's a flame that can burn as long as we choose to tend it. Yet society keeps trying to blow it out. Even the language we use betrays our biases. Terms like dirty old man or cougar weaponize age and desire, framing natural impulses as predatory or pathetic. This linguistic stigma doesn't just shame individuals, it polices everyone, creating a chilling effect where people suppress their needs to avoid ridicule. But what if we reframed the conversation? What if we recognized that an 80-year-old's masturbation ritual is as worthy of respect as a teenager's, that it's not about clinging to youth, but embracing the full spectrum of human experience? Biology, of course, plays a role in aging bodies. Hormonal shifts, slower arousal, or physical limitations. But these changes don't erase desire, they redefine it. For some, pleasure becomes less about performance and more about connection with oneself or a partner. For others, it's an opportunity to experiment with patience, creativity, or new forms of intimacy. A 68-year-old widow might find solace in self-pleasure as a way to reclaim her body after loss. A 75-year-old man with diabetes might discover that mindful masturbation helps him stay attuned to his physical needs. Far from being a decline, these adaptations are acts of resilience, proof that desire is as dynamic as life itself. Yet the myth persists, in part because it serves a purpose. A culture obsessed with youth profits from our fear of aging. If we're convinced that growing older means fading into the background, we'll buy products, surgeries, and lifestyles promising to fix us. But what if we rejected this scarcity mindset? What if we saw aging not as a loss, but as an expansion, a time when sexuality freed from societal pressures becomes more authentic? This isn't just theoretical. Consider the growing movement of senior sex educators and advocates like Joan Price, who at 80 writes boldly about older adult sexuality, or Dr. Betty Dodson, who until her passing at 91 championed sexual empowerment for women of all ages. Their work isn't radical, it's restorative. It reminds us that pleasure is ageless and that our right to explore it doesn't diminish with time. So the next time someone implies you're too old for desire, remember, they're not speaking from science or empathy. They're echoing a narrative designed to shrink your world, but you don't have to live in their narrow story. Reject the myth, embrace your truth. And speaking of truth, let's confront another layer, the profound impact of self-pleasure on mental health, a connection that science is only beginning to fully unpack. Let's delve into the profound connection between self-pleasure and mental health, a relationship that transcends mere physical release and taps into the very core of emotional resilience. As we age, life often presents us with unique psychological challenges: the loss of loved ones, shifts in identity post-retirement, or the quiet ache of loneliness that can creep in when social circles shrink. These experiences, while universal, are rarely discussed with the depth they deserve. Yet, amidst these trials, masturbation emerges not just as an act of self-care, but as a vital tool for nurturing mental well-being. It's a private rebellion against despair, a way to reclaim agency in a world that sometimes feels like it's moving on without us. Consider the biochemistry at play. When we engage in self-pleasure, the brain releases a cascade of neurotransmitters, endorphins, dopamine, oxytocin, that act as natural mood elevators. Endorphins, often dubbed the body's feel-good chemicals, alleviate stress and pain, offering a reprieve from the chronic discomfort that can accompany aging. Dopamine, linked to reward and motivation, counters the lethargy and apathy that depression may bring. Oxytocin, the bonding hormone, fosters a sense of calm and connection even in solitude. For someone navigating grief or isolation, these biochemical shifts can be transformative. Imagine a widow reeling from loss, finding momentary solace in a practice that reminds her she's still capable of joy, or a retiree grappling with a sudden void in purpose, rediscovering a spark of vitality through self-touch. This isn't indulgence, it's survival, but the benefits extend beyond neurochemistry. Masturbation is an act of mindfulness, a grounding ritual that anchors us in the present. In a culture obsessed with productivity, older adults are often sidelined, their worth wrongly tied to what they do rather than who they are. Self-pleasure becomes a radical affirmation of existence. It's a space where there are no to-do lists, no societal expectations, just the rhythm of breath and sensation. For those wrestling with anxiety, this focus on the here and now can quiet the mind's chatter, offering respite from worries about health, finances, or mortality. It's a reminder, in this moment I am alive, and that is enough. Loneliness, a silent epidemic among older adults, further underscores the mental health stakes. Studies show that social isolation increases the risk of dementia, heart disease, and premature death as much as smoking 15 cigarettes a day. Yet masturbation offers a paradoxical remedy: intimacy with oneself. It's not a substitute for human connection, but a complementary practice that reinforces self-worth. When physical touch is scarce, whether due to pandemic-era restrictions, mobility issues, or the passing of a partner, self-pleasure becomes a bridge to the tactile world. It whispers, "You are not forgotten. You are deserving of tenderness." For many, this private act is a lifeline, a way to stave off the numbness that isolation can breed. Yet the shadow of stigma looms. Many older adults internalize societal messages that label their sexuality as unseemly or pathetic, breeding guilt that erodes mental health. A 70-year-old man might feel shame for masturbating, fearing judgment from adult children who view him through the lens of elderly parent rather than a multifaceted human. A woman in her 80s might dismiss her desires as silly, conditioned by a lifetime of cultural silencing around female pleasure. This internalized shame is corrosive. It isolates people from their own bodies and amplifies feelings of worthlessness. Breaking this cycle requires reframing self-pleasure as an act of self-respect, not secrecy. Imagine the liberation in thinking, "My needs matter." At every age, therapeutic frameworks support this shift. Sex therapists increasingly advocate for masturbation as a tool in treating depression and anxiety, particularly for older adults. Dr. Lori Watson, a renowned clinical sexologist, notes that for many clients, reconnecting with their bodies through self-touch rebuilds confidence eroded by ageist narratives. It's about reclaiming ownership, she says. When you prioritize pleasure, you're telling yourself you're worth the effort. This ethos aligns with broader mental health strategies that emphasize agency and self-compassion, cornerstones of resilience. Of course, mental health is not a monolith. For some, physical limitations, arthritis, chronic pain, or hormonal changes may complicate the experience, yet these challenges can also foster creativity. A stroke survivor might explore new erogenous zones, discovering pleasure beyond conventional norms. Someone with limited mobility might use pillows or assistive devices to enhance comfort, transforming the act into an exercise in adaptability. These adaptations aren't compromises. They're testaments to the enduring human capacity for reinvention. As author and disability advocate Andrew Gurza remarks, pleasure is a right, not a privilege, and it's infinitely customizable. Cultural narratives play a role here too. In communities where aging is revered, think of Japan's celebration of ikigai, a sense of purpose, or indigenous traditions honoring elders. Sexual expression is often viewed as a natural part of life's continuum. Contrast this with Western media's erasure of older desire, and it's clear that mental health outcomes are intertwined with cultural context. By challenging ageist norms, we don't just validate masturbation, we validate the complexity of older adults' inner lives. Yet the path forward isn't solely individual. Healthcare providers must normalize conversations about senior sexual health. A 2023 study in The Lancet revealed that fewer than 10% of geriatricians received training in addressing patients' sexual needs, leaving many to suffer in silence. Imagine the impact if a doctor asked, "Are you satisfied with your sexual well-being?" during a routine checkup. Such dialogue could destigmatize self-pleasure, linking it to holistic health rather than pathology. Ultimately, masturbation is a mirror. It reflects how we feel about ourselves. For those who've weathered decades of societal judgment, embracing it is an act of defiance. It's saying, "My mental health matters, my joy matters, my story isn't over." And as we peel back these layers, we uncover another truth. The mind and body are not separate realms, but partners in the dance of aging, which brings us to the next frontier: how physical health and self-pleasure are intertwined in ways that science is only beginning to fully grasp. Let's shift our focus to the remarkable resilience of the human body and the creativity it invites as we age. You've just heard how mental and physical health are deeply intertwined, how self-pleasure can be a sanctuary for the mind. But what happens when the body itself changes, as it inevitably does? Arthritis stiffens joints, mobility becomes a negotiation, hormones shift, and skin grows thinner. These aren't failures, they're milestones of a life lived. Yet, society often frames these changes as obstacles to pleasure, as if desire must shrink to fit a narrowing physical scope. Nothing could be further from the truth. Adaptation isn't a compromise, it's an art form, a testament to the ingenuity of the human spirit. Consider the practical realities. For many, the mechanics of masturbation evolve with age. Hands that once moved with ease might now ache with arthritis, making certain grips or motions challenging. Hormonal changes like menopause or andropause can alter arousal patterns or sensitivity. Vaginal dryness or erectile dysfunction, often pathologized as problems to fix, are simply natural shifts, signposts, not stop signs. The beauty lies in how we respond. Lubricants, for instance, aren't just products. They're allies. A silicone-based gel can transform discomfort into ease, while water-based options offer compatibility with toys. And let's talk about those toys. The market now boasts ergonomic designs, vibrators with easy grip handles, adjustable intensity settings, or app-controlled devices that cater to limited mobility. These innovations aren't crutches, they're tools of empowerment, designed to meet bodies where they are. Positioning, too, becomes a creative endeavor. A pillow under the hips can alleviate back strain. Sitting in a supportive chair instead of lying down might reduce joint pressure. For those with limited hand mobility, a body wand or a toy mounted to a bedside table can shift the labor from fingers to larger muscle groups. Even mindfulness practices, like slowing down to savor sensation rather than chasing climax, can redefine pleasure as a meditative act. A 2019 study in the Journal of Sex Research found that older adults who adapted their sexual practices reported higher satisfaction, not despite these changes, but because of them, as one 72-year-old participant shared. "I've learned to listen to my body like it's a conversation, not a demand." But adaptation isn't just about gadgets or techniques. It's also an emotional journey. There's grief, of course, in releasing old routines. A man who once relied on spontaneous erections might mourn that chapter, only to discover the deeper intimacy of intentional, slower connection. A woman navigating vaginal atrophy might initially feel betrayed by her body, then stumble upon the joy of clitoral focus, which many report as more satisfying than penetrative methods. These stories aren't exceptions. They're blueprints. They remind us that pleasure isn't a rigid script, but a fluid dialogue. As sex educator Stephanie A. Sanders notes, aging asks us to expand our definition of normal. What feels good today might not be what felt good a decade ago. And that's not loss, it's discovery. Yet societal silence around these adaptations can breed isolation. How many older adults endure needless discomfort, unaware of solutions as simple as a silicone lubricant or a heated massager? How many dismiss their desires entirely, believing their bodies are broken? This is where community and education become lifelines. Online forums like senior sexuality groups or workshops led by gerontological sex therapists are quietly revolutionizing the landscape. They offer practical tips, like using a tennis ball to massage sore muscles before self-pleasure, or exploring audio erotica for those with visual impairments. But more importantly, they normalize the conversation. As 68-year-old workshop attendee Maria shared, hearing others talk about lube and arthritis creams made me feel less alone. It's like we're all engineers tinkering with our own joy. Of course, adaptation sometimes requires professional guidance. Pelvic floor therapists, for instance, can address pain during arousal with targeted exercises. Endocrinologists might adjust hormone therapies to reignite libido. Even occupational therapists are joining the conversation, suggesting adaptive devices originally designed for daily tasks, like reachers or button hooks, to aid in solo play. The key is to ask, to persist, to treat sexual well-being with the same urgency as heart health or mobility. After all, why should a hip replacement warrant a detailed rehab plan, but a plea for help with sexual discomfort be met with awkward silence? This brings us to the heart of adaptation. It's not just about the body, but about permission. To experiment, to stumble, to redefine. A 79-year-old with Parkinson's might use a weighted blanket to steady tremors during self-touch, turning a challenge into an opportunity for deeper sensory engagement. Another might explore tantric breathing, finding that delayed gratification heightens pleasure in ways their younger self never imagined. These acts aren't surrenders to age, they're revolutions against limitation. And yet, none of this happens in a vacuum. Adaptation thrives in environments of openness, conversations with partners about changing needs, consultations with doctors who prioritize holistic health, or even quiet internal dialogues that replace shame with curiosity. Which leads us to our next frontier, the power of communication, not just with ourselves, but with those who walk beside us in this journey. If adaptation is the art of navigating change, communication is the bridge that connects our inner world to the outer, a lifeline that transforms solitary acts into shared understanding, even when we're alone. Masturbation, often viewed as the ultimate private act, doesn't exist in a vacuum. Whether you're partnered or single, your relationship with self-pleasure ripples into your connections with others, your healthcare choices, and your own self-perception. Yet talking about it remains one of the most daunting frontiers, especially for older adults raised in eras where sexuality was shrouded in secrecy. Let's dismantle the silence piece by piece and explore why dialogue with partners, doctors, and even ourselves isn't just helpful, it's revolutionary. Start with partnership. For those in long-term relationships, masturbation can feel like a taboo topic, tangled in unspoken fears of rejection or inadequacy. A man might hide his solo practices, worrying his wife will interpret them as dissatisfaction. A woman might suppress her desires, fearing her husband will feel emasculated. These assumptions thrive in the dark, but when brought into the light, they often reveal deeper truths. That self-pleasure isn't a threat to intimacy, but a complement to it. Dr. Tammy Nelson, a sex therapist and author, emphasizes masturbation in a relationship isn't about opting out, it's about owning your pleasure so you can show up more fully for each other. Imagine a couple in their 70s married for decades who begin sharing their solo experiences. They might discover new techniques to incorporate into partnered sex, or simply deepen their empathy for each other's changing bodies. The key isn't uniformity, but curiosity. But how to begin? For many, the first step is reframing the conversation. Instead of framing it as a confession, "I need to tell you something," approach it as an invitation. "I've been exploring ways to feel more connected to my body. Can we talk about this?" Focus on shared goals, sustaining intimacy, supporting each other's health, or simply fostering honesty. For those navigating post-retirement relationships or new partnerships later in life, these dialogues are equally vital. A widow re-entering the dating scene at 68 might broach the topic of masturbation with a new partner as a way to articulate her boundaries and desires, setting the stage for mutual respect. Of course, communication isn't limited to romantic partners. For single older adults, the conversation often turns inward. How do we speak kindly to ourselves about our needs? Many carry internalized scripts from childhood. Good girls don't touch themselves, or real men don't need help. That breeds shame. Rewriting these narratives is an act of self-advocacy. Affirmations like "my body deserves care" or "pleasure is my right" might feel awkward at first, but over time they chip away at decades of conditioning. Journaling can also be a powerful tool. A 65-year-old divorcee might write, "Today I prioritized my joy without apology, transforming guilt into pride." Then there's the medical realm, a space where communication barriers can have dire consequences. Many older adults sidestep discussions about sexual health with doctors, assuming it's irrelevant or inappropriate. A 2018 study in the Journal of Sexual Medicine found that 70% of adults over 60 avoid mentioning sexual concerns to their physicians, often due to embarrassment or fear of being judged. Yet, these omissions can lead to overlooked issues: medications that suppress libido, untreated pain during arousal, or even symptoms of underlying conditions like diabetes or cardiovascular disease. The fix? Prepare. Write down questions beforehand. Could my blood pressure meds be affecting my arousal? Or broach the topic indirectly. I'd like to discuss maintaining my overall well-being, including sexual health. Remember, you're not asking for special treatment. You're advocating for holistic care. Healthcare providers, too, must evolve. Geriatrician Dr. Anna Cheng notes, "We're quick to ask about bowel movements or sleep, but skip the questions that impact quality of life just as deeply." Progressive clinics are adopting intake forms that normalize sexual health queries for all ages, while training staff to respond without flinching. Until this becomes standard, persistence is key. If a doctor dismisses your concerns, seek a second opinion. Your needs are valid. Cultural context also shapes these conversations. In LGBTQ+ communities, where sexual agency has often been hard-won, older adults may face unique challenges, like finding inclusive healthcare or navigating intimacy after decades of stigma. A gay man in his 70s, having survived the AIDS crisis, might grapple with trauma that complicates self-pleasure, necessitating conversations with therapists who understand his history. Similarly, transgender elders undergoing hormonal transitions may need tailored advice on maintaining sexual well-being. These dialogues require not just courage, but allies, professionals and peers who honor the full spectrum of identity. Technology, too, plays a role. The rise of telehealth has made discreet consultations with sex therapists more accessible, while online communities offer anonymity for those seeking advice. A grandmother in rural Kansas can now attend a virtual workshop on senior sexual wellness, her screen name shielding her from stigma. Yet the digital divide persists. Many older adults lack broadband access or tech literacy, underscoring the need for in-person resources, support groups at senior centers, pamphlets in clinic waiting rooms, or workshops at retirement communities. At its core, communication about masturbation is an act of defiance, a rejection of the lie that aging erases complexity. It's saying, "I am more than my age. I am a mosaic of desires, fears, and triumphs." And when we voice these truths, we give others permission to do the same. Consider the ripple effect. A man mentioning his use of a vibrator to his urologist paves the way for future patients. A woman discussing post-menopausal dryness in her book club normalizes the topic for peers. Each conversation chips away at the stigma, creating a world where a 75-year-old's sexual well-being is treated with the same gravity as their cholesterol levels. Yet, even with open dialogue, challenges arise. What if pain persists despite lubrication? What if guilt lingers after decades of religious dogma? This is where the final piece of the puzzle comes into play, seeking expert guidance, not as a last resort, but as an act of self-respect. Even with open dialogue and adaptive strategies, some challenges demand expertise, a reality that's neither failure nor flaw, but a testament to the complexity of being human. Perhaps you've tried every lubricant on the shelf, yet discomfort lingers. Maybe guilt, rooted in decades-old dogma, still whispers that your desires are wrong. Or maybe a health condition, cancer, diabetes, heart disease, has rewritten the rules of your body, leaving you unsure where to turn. This is where professional guidance isn't just helpful, it's transformative. Seeking help isn't a surrender, it's a reclamation. It's saying, my well-being matters enough to invest in. Let's start with the physical. Aging bodies often navigate intersecting health issues that ripple into sexual well-being. A prostate cancer survivor might grapple with erectile dysfunction post-surgery, unaware that pelvic floor therapy could restore both function and confidence. A woman with osteoporosis might fear that certain positions could risk injury, not knowing a physiotherapist could tailor safe, pleasurable movements. Even common medications, antidepressants, blood pressure pills, can dampen libido or delay arousal, yet patients rarely connect these dots without a clinician's insight. The fix isn't always a pill. Sometimes it's information. For instance, a 2017 study in menopause revealed that over 60% of women experiencing painful intercourse found relief through topical estrogen, a solution many never discover because they don't ask. But asking requires courage, especially when cultural ghosts haunt the exam room. Many older adults grew up in an era when doctors were authority figures, not collaborators. Add the taboo of discussing sex, and it's no wonder a 2021 AARP survey found that only 12% of adults over 65 had ever mentioned sexual concerns to a provider. Yet, the consequences of silence are real. Untreated vaginal atrophy can lead to chronic inflammation. Unaddressed erectile dysfunction might signal cardiovascular issues. Painful arousal could mask conditions like lichen sclerosis. The stakes are both intimate and immense. The key is to reframe the ask. Instead of viewing a doctor's visit as a confrontation, "I have a problem," approach it as collaboration. "I want to thrive." Prepare a script. "I've noticed changes in my sexual response since starting this medication. Can we explore options?" Or, "I'd like to stay sexually active. What should I consider given my arthritis?" If embarrassment lingers, remember, clinicians are trained for this. A urologist isn't fazed by erectile concerns. A gynecologist won't blush at vaginal dryness. As nurse practitioner Rachel Rubin advises, if your doctor acts uncomfortable, that's their issue, not yours. Seek someone who listens. Therapy, too, is a lifeline. For those wrestling with shame, whether from religious upbringing, internalized ageism, or past trauma, a sex-positive therapist can be revelatory. Cognitive behavioral techniques might reframe guilt, "I'm too old for this," into empowerment, "My body is mine at any age." Somatic therapy could help reconnect with physical sensations dulled by dissociation. For LGBTQ+ elders, particularly those who lived through periods of criminalization or pathologization, affirming therapy can heal wounds that self-pleasure alone cannot. Then there's the burgeoning field of geriatric sexual health specialists, professionals bridging the gap between aging and intimacy. Dr. Stacy Tesler-Lindau's pioneering work at the University of Chicago, for instance, focuses on restoring sexual function in older adults post-cancer. Meanwhile, platforms like Sexual Health Solutions for Seniors offer telehealth consultations, discreetly connecting users with experts versed in everything from hormonal shifts to adaptive sex tech. These resources aren't luxuries, they're necessities in a world where the average physician receives less than 5 hours of sexual health training. But expertise isn't confined to clinics. Peer-led communities, online forums, senior center workshops are quietly revolutionizing support. In these spaces, a 78-year-old can learn about clitoral suction devices from a fellow retiree, or a widower might share how mindfulness practices reignited his relationship with his body. Here, vulnerability becomes solidarity. As one member of the Silver and Sexy Facebook group posted, "We're all engineers here, tinkering with our own joy." Technology, too, is a double-edged sword. While apps like Row and Nurex offer discreet access to erectile dysfunction treatments or lubricants, the digital divide leaves many older adults behind. Solutions: community health workers conducting home visits with tablet-based tutorials, libraries hosting senior tech hours to navigate online resources. Even simple interventions, like illustrated pamphlets in large print, can democratize knowledge. Yet, barriers persist. Cost remains a hurdle. Medicare often excludes sexual health services, relegating them to elective care. Advocacy is essential. Why should a prostate exam be covered but not a consultation on post-prostatectomy sexual wellness? Grassroots movements are pushing for change. But until then, sliding-scale clinics and non-profit initiatives, like the Safer Sex Seniors program, fill gaps. Ultimately, seeking help is a radical act of self-respect. It's the 70-year-old who, after a lifetime of silence, tells her therapist, "I want to enjoy my body again." It's the widower who joins a cardiac rehab program and asks, "How can I stay sexually active safely?" It's the transgender elder partnering with an endocrinologist to balance hormone therapy with libido. These stories aren't just about solutions, they're about sovereignty. As we've journeyed through these 6 truths, normalcy, myth-busting, mental health, adaptation, communication, and expert guidance, one theme emerges. Aging isn't a retreat from desire, but an invitation to deepen it. The final word isn't a conclusion, but an opening to those 62 to 83, Your sexuality is yours to embrace, redefine, or release on your terms. Let's replace shame with education, stigma with compassion. Whether you masturbate daily or never again, what matters is honoring your needs. Thank you for listening, and remember, aging is inevitable, but living fully is a choice. Choose boldly.